Yeah, you haven't got Vanessa Kerry, you've got me, David Schruckman. I was a poor stand-in, but it's a great honour to be here, so thank you to the SMI for asking me. So I was a BBC correspondent for many, many years reporting on climate change. This is my 12th COP, and I can't tell you how inspiring it is that there is now a health day. I mean, for way, way, way too long, health was seen as a separate issue, and I think we've had a fantastic reminder from Minister Nissia about why this matters. I mean, in the country of Brazil, you've got a drought in the Amazon rainforest, predicted by the models 15 years ago, and extreme flooding in the south of Brazil, also predicted by the models. We know what we're heading for with a hotter planet. It's a more hostile climate. So that's the context for the impact on human health, also the impact on healthcare systems. But as we've heard from Pascal, you know, the healthcare system is a big emitter, and we know that emissions cause harm. So how do we move our way through that? So let me crack straight on, invite our panel up to the stage, and we're going to discuss some of these key issues. So Fiona Adshead, please come up, and perhaps all of you now. Paul Hudson and Chris Lift. Nice warm welcome to the stage. Great. Is this working? There we go. Maybe I'll just adjust that. I need to keep you in my eye line, you see, otherwise I don't want you running away with things. Paul, let's pick up on this theme of decarbonising the patient pathway. Not straightforward, because you've got to involve lots of different players, public sector, private sector. In practical terms, how's that going?
Well, maybe just pick up on quickly on some of the comments that have been made. It is important. It's a health day. It's my second COP. We feel the responsibility. You heard all the words from the great presenters this morning. There is a crisis. It's shaking the very foundations of the delivery of healthcare and patients' lives themselves. It's time to move. You know that. We need to get to a low-carbon, resilient, equitable healthcare delivery system worldwide. So we know our responsibilities. The role that I play leading the patient care pathway piece for Pascal, our great chair, is really just trying to get back to basics and say we're doing a lot on upstream, on how we manufacture medicines, how we supply them, how we distribute them. But really, the delivery of healthcare itself is a big battleground. Mm-hmm. It's often cited now that the carbon impact of delivery of health is more than the aviation industry creates in any given year. And consequently, that surprises people, right? Because people don't fully get what it takes to deliver health and how it can be delivered to have less of an impact. I think Pascal said it up front. There's this big concern that climate creates a health problem, but people have not yet, the penny hasn't dropped, that delivering health creates a climate problem, which creates a health problem. And we're in that world now. So just a couple of small examples. You know, if a healthy adult creates about 16 tons of carbon in their adult life, and somebody, say, with type 2 diabetes creates about 48 tons. And you look at the disparity and you say, well, why is that? And inevitably, it's because of the way their healthcare is administered, the medicines are made, distributed, brought to them. If you can educate and if you can coach and counsel a patient not to become a diabetic, if there's an opportunity, you can save 3x the carbon creation. And we have to really say to ourselves, when could the intervention be? Where could prevention be? Where could delivery of healthcare be? And then lastly, and in partnership with AstraZeneca, we launched an immunization for RSV just a few months ago to protect 90% of babies from getting a very difficult respiratory virus during the winter. And you can avoid 68% of the healthcare costs and emissions by intervening. And we've got to reset ourselves a little bit and say, when should we intervene? Not just because of the individual's life, but the burden on the planet, which is out of control at the moment.
So there's a lot of work to do, obviously, and huge pressures. Fiona, you've been working on this issue of decarbonising the health system, I'm not going to say for a while. You're a pioneer of thinking about this, and your work is much praised and invaluable. As you sort of face that that challenge, what's different, if you like, about having the SMI Health Systems Task Force get involved? I mean, what does it bring that didn't happen before?
It's a good question, and I mean, you've heard two reasons already, or seen them. It's chief exec led, and it's really action.
And that didn't happen before?
No,
right.
Not in this way, not really to drive change. Okay. But I think, when I think about the why, I guess one of the reasons for me is that we're absolutely determined to deliver on the promises that we've committed to at COP27. We're going to do that so that when things get difficult, we have open and honest conversations to solve the problems. But the second reason, I think, is about the mindset we bring. So we know that this is groundbreaking. We know that we're trying to do things that people haven't done before. So we're bringing an experimental mindset. We're recognizing that nobody has all the answers and that everybody's got something to bring to this and everybody's got something to learn. And I think finally, because we're very action orientated, we're also really attracting others to work with us. So for example, in the work I'm doing on greener clinical trials, we've got colleagues from Bayer, is bringing people together. So yes, I mean, I think it is different, and I'm optimistic that if we keep going like this and we really work across the system and accelerate change, that we can have a real impact.
And things are now so urgent, but you are sensing momentum now.
Yes, I mean, it's really changed. I've been working on this issue for 20 years now, and it really now, in the last couple of years, is really gaining momentum, and it's fantastic to be here today. And SMI are helping to turbocharge our efforts, absolutely.
And Bill, picking up on this theme of collaboration, which is obviously absolutely fundamental to delivering this, how important do you see collaboration in terms of dealing with some of the problems we know that the healthcare system is facing?
Well, it's really essential that we collaborate because the nature of the problem and the rate at which the problem is intensifying, I think it's not always obvious to folks, but when you have the sort of climactic shocks that we're starting to experience, you have this really pernicious intersection of food insecurity, malnutrition, and disease. And those things are not separate problems. They magnify, they amplify each other. And so I think the sort of public-private partnerships and lots of partnerships is essential to chipping away and kind of holding back the tide on this. And many experts, Bayer's been working on a treatment for Chagas disease. We have now. We're producing it. We've got a partnership with WHO to distribute it to the countries affected most. Chagas disease is a tropical disease, and because it's a tropical disease, and the tropical region is expanding at the moment, and the disease is expanding. And now we're having dialogue with colleagues in Brazil about how we can make that production local, because that's another part of resilience. So that's one example of partnership. Another, this week we've announced a collaboration with the Malaria Medicines Venture to share a library of 50,000 compounds that we have that have promise for malaria treatment. And again, that's something that we have that probably wouldn't go very far in our hands, but with the Malaria Medicines Venture, it can actually go somewhere, and so they need it, we need them. And then finally, there's really insufficient funding everywhere in the world for this adaptation of the healthcare system. This week we're announcing at COP28 a partnership with the Asian Venture Philanthropy Network to look for, basically connect interesting ideas and projects with funding in Asia at this intersection of health and climate. So we gotta accelerate the pace even as the problem's accelerating.
Pernicious intersection is a powerful phrase that I might have to steal. may give you credit. Chris, picking up on Bill's points, I mean, I know a big theme for you at Reckitt is prevention, with I guess multiple benefits that
that can flow from that in many different ways.
That's right. I mean, I think both Paul and Bill touched on it. We have a health care system that largely cannot keep up with what it's being asked to do.
Even now.
Now. We have a climate crisis that's getting worse, and we have a massive issues of inequity. Billions of people that don't have access to basic health care, adequate health care, and even food security or reliable water supply. All these things intersect. So what we believe, one way out of this very complex set of problems is preventative care, greater self-care, and a lot of that has to be community-based. It's more economical, it's more sustainable. It has a whole range of benefits, obviously better lives at the end of the day, better health outcomes. So that's a big frontier, and it actually is a common problem across the developed and the developing world. Sometimes we don't necessarily see those common themes, but it's entirely common. So we see some of these issues play out in London, and we see them in Lagos, and we see them in Delhi. They take a different shape because the specific climate issues are different. The strength of the healthcare system is obviously a bit different. But it happens in all the megacities around the world, and really in all communities around the world, and there is an unmet need. So preventative care is a really big element. One of the things we've started saying out loud, because it wasn't something we used to say, but the healthcare system starts at home. We tend to think about hospitals and maybe doctors, but actually the healthcare system starts at home. And so preventative care, patient education, and access to good self-care is absolutely critical to solve this problem. I don't think we have time or the funding to build enough hospitals to solve this problem, although we should try. But clearly, self-care is a big element.
With the education being a big theme in that.
Absolutely.
In order to spread the word and help people become more aware of the issues. So while all that's going on, Paul, let's drill more into the decarbonisation effort. So one of the work streams is getting a carbon footprint of some medication. That's not straightforward, is it? There are different ways of calculating that. How's that going, and how's the SMI involved in that?
Well, I think we have to be honest with ourselves. You can't reduce something that you can't measure. And we've spent a long time debating these subjects, but we have to put a fixed point to work from. And it takes quite a lot of effort and transparency, radical transparency, to share enough data.
That's another great phrase I haven't heard before. Well,
pernicious.
I like that. Pernicious intersections and radical. Okay, I'm just going to. What do you mean by radical transparency?
I think Fiona said it that we have a group of very senior people together on these subjects, and people are very willing to share all their information to allow a full understanding of upstream and downstream delivery of health and manufacture medicines. We do a life cycle assessment, which is what we're bringing forward, robust, independently reviewed, to say, okay, so what is the carbon impact of every single step of the value chain in the discovery, manufacture, diagnosis, delivery of healthcare to those that need it. And nobody's ever drawn that line in the sand before. And drawing it is a very important first step for us because, again, we get to actually say, we're going to go from here to here. And we can measure it, and then we can get it done. I think there's a willingness that's never been there before, but it can't just be a scattergun approach. It has to be very targeted at doing the right thing. And people simply have no idea. The simple getting in a car, if you're a chronic disease patient, driving to a hospital, driving round it 5 times looking for somewhere to park, then trying to park, then going into a hospital that's overheated or overcooled, or too many lights on or too few. And all of these things keep aggregating. But the point was just made about education, educating the next generation of physicians to say, what would be the right thing to do for these patients, for this patient, and what is the sustainable thing to do? We learned in the pandemic, you can deliver hybrid healthcare. You can do some consultations remotely and important investigative procedures in centers of excellence. But you shouldn't do everything in person. Why? It's just not necessary. So the next wave of physicians need to understand the the environmental burden of the choice they make in helping the patient. Likewise, the patient ultimately needs to be given the greener choice of how they would like their healthcare to be delivered. It may be, of course, if it's a diagnostic test, you will go in person, of course. But if it's coaching, counseling, check-ins, annual reviews, you don't need to. And it adds up. That's why it's double aviation, which is why measure it, be radically transparent about it, make sure the physicians and the patients both know if they make a different choice, they can be kinder on the environment and in turn better for their health.
And picking up on the digital point effectively, I mean, Fiona, what are the issues for you around that? I mean, there's been some controversy, hasn't there, about not everybody who's perhaps elderly wants to talk to a doctor on a phone, for example, or whatever. What are the issues for you going forward with that? Because clearly it's a major way to reduce carbon emissions.
It is, and I think we need to take that balanced approach. I mean, I think we've heard in the last couple of days how having digital devices can transform the work of community health workers in remote communities, for example. And we know from the studies we've already done of care pathways that a smart inhaler can actually support a patient to manage their asthma better. So we know it can unlock huge potential. And we also know that, as you were saying, you know, having treatment at home or not having to travel to the hospital can actually make patients manage their treatment and complete it. And yet, we also know that some patients don't have access to digital devices. And I think that's where, as Paul was saying...
So that's the equity issue then,
It's
right?
the equity issue. And we need to really bring patient preference into this. We need to understand. I mean, we looked at the opportunity of clinical trials, and one of the big things that happened during the pandemic was so-called decentralized clinical trials, which are enabled by digital. And one of the reasons why we're coming up with a standardized framework for measuring it is because we want to know, is that going to be best for the environment? You know, how could that best be for the environment? And then also we will need to factor in patient choice. But I think ultimately digital can unlock it. But I think what we've learned from looking at how you make healthcare systems equitable is that you can't just assume things that you think will be equitable will be. You actually need to check it out and test it. You need to do so-called equity audits. And the same is true, and that's why we're placing so much evidence and, you know, focus on metrics, because we need to be able to do that for environment too. We need to test out, are the assumptions we're bringing to something actually right when we look at it in practice? You know, how does it
So
work
you've got to
out?
get the data
You've
clear
got to-
on that so you can form
It's
a
got to
judgment.
be
Yeah.
a combination of data, personal preference, and then really focusing on how to achieve the best health outcome first, but also the one with the least environmental impact.
Great. Now, often in these climate discussions, there are global targets or national targets, but very often, Chris, a key focus is city-based or place-based, to use the jargon, which actually I don't like the phrase place-based. But anyway, I prefer the city focus. I mean, cities are simultaneously kind of crucibles of innovation, aren't they? And population centres and centres of excellence, also uniquely vulnerable in many ways to the effects of climate change. What for you is the benefit, perhaps, of thinking in a city focus?
Well, I think the problems are local. I think we can see that all around the world. So while there's common themes, it all happens in a city, in a community, and 70% of the global population is going to be living in these mega cities around the world in not many years from now, and this is where this issue is going to occur. If we think about issues of poor sanitation, access to clean water, that really shows up in an urban setting. The urban setting exacerbates a lot of the issues with global warming. When you have the floods, etc., it's extremely disruptive to the provision of healthcare, and obviously it has adverse health outcomes for the whole population. So solving it at a city level is really important, also because the stakeholders are different. In some places you have community health workers that are actually on the front lines of delivering the type of care that we need more of, and so you have to, I think, lean into that method and empower them digitally and other ways, support them otherwise. In other places, I think it's about the pharmacy. In many megacities, there's a pharmacy around the corner. What can the pharmacy do more of? And some of that would be an omni-channel solution, so you don't have to go there. Again, maybe fewer places, but you can deliver a lot of that care through other ways that increasingly consumers are very comfortable with. So I think you have to solve it city by city. It's a different set of stakeholders, and that's how I think we can get practical about this. That's how we get to real action.
Thanks for that. And Bill, just picking up on that, I mean, clearly, as we look forward, your sense of the role of companies, I mean, very often one thinks of health services, particularly in the UK context, the National Health Service, but the role of companies in driving this agenda, and perhaps looking forward to a time when actually we, let's say, don't end up with a more hostile climate. We don't end up with the kind of things the climate models are casting forward.
Yeah, I mean, I think there's just a great opportunity for additive impacts. You know, policymakers, governments are trying to take action. Companies can take action, and we can move things, you know, kind of one piece at a time. I think one focus that we have is on how do we strengthen the most vulnerable communities. In addition to healthcare, we're very involved in the agriculture world as the world's leading supplier of agricultural inputs. And we interact with smallholder farmers, which is the lingo for basically subsistence farming around the world, which is millions and millions of people. And as an example, but as we face this climate crisis, it's bringing on the crisis of malnutrition, of diseases like asthma, allergies. And so one of the things we're doing is we have an internal commitment, a company commitment to reach an incremental 100 million people with self-care solutions, the kind of things that Chris is talking about, you know, opportunities where people don't need a healthcare provider, but can actually access something that's going to help them with their health issue. And we take for granted in richer countries that everyone has access to these things, but it's not so in much of the world. And so that's, you know, we're one company. 100 million is a small part of the world, but it's meaningful, and so that's something we can do. Another example is with climate poverty comes more migration, and women and girls are more adversely affected even by these things, and they don't have access to sexual and reproductive health services. So we have a commitment to access 100 million incremental women with modern methods of contraception by 2030, and so these are kinds of things that they're baked into our mission and kind of our company culture, but they're also baked into our compensation. You know, if we don't deliver on those 200 million goals, then yeah, we don't get paid. So I think it makes it real beyond kind of the heart, but we mean business.
I think you're working towards a positive intersection. It's the flip of the pernicious one. And we might all borrow that phrase. Look, we've come to the end of our time here. I've just noticed, because it's now 11:15, that I think around now the COP28 presidency is due to release its statement on climate and health. And that might set the tone for how this absolutely vitally important issue progresses through COP28, COP30, and onwards. But it's been fascinating to hear your remarks. Thank you all very much for doing this. Would you all join me in thanking our panel? Thank you.
Can I have...
Thank you. Give you plenty of room.
Hi, everyone. I just wanted to express, so I'm Jen Jordan-Saifi. I'm the CEO of the Sustainable Markets Initiative. And on behalf of the SMI and also His Majesty, I just want to thank all of you for coming. The Health Systems Task Force is one of the pioneering task forces of the SMI. It's really leading change around the world. It's working with all of our other task forces and providing a model on how, you know, we really tackle this issue, how you link, you know, the human side of what's needed with the climate side, with the biodiversity and the nature side of the challenge. And I think looking at a system and recognizing the system as one around the world. Like that's how we're going to tackle this problem. So I'm just extremely grateful. I don't want to take too much time, but again, His Majesty is very, very focused on this and really appreciates you guys taking the time to come here today and to be the leaders that you are being. And we do genuinely hope that you can be an inspiration to other CEOs around the world on how to get this job done. So thank you very much. Thank you.